When it comes to treating diabetes, what we really mean is more about normalizing body weight, maintaining good physical fitness, establishing a healthy lifestyle, learning proper nutrition, and learning the correct dosages for insulin administration. That is why diabetes schools have been established. During the day, the patient independently decides several times, anywhere from 3 to 7 times the dose of insulin to administer. Naturally, the doctor cannot be present next to every patient at all times. That is why special tables have been developed to match food products, for example, expressed in bread units. One bread unit equals 10 to 12 grams of carbohydrates or 48 kilocalories. There are special carbohydrate substitution tables, since patients need to have a varied diet and cannot eat the same type of food all the time. And based on this, the patient independently calculates the insulin dose for 3 main meals and 3 snacks. So it's like a 6-meal plan. This is beneficial both for healthy people and for patients with diabetes. So what is insulin? Insulin is the conductor that allows glucose to enter the cell or insulin-dependent organs. Which of these are the most important? They are the liver, muscles, and adipose tissue. From the gastrointestinal tract, glucose enters the liver under the influence of insulin. There it is stored in the form of glycogen. Adipose tissue is synthesized, muscles function, and naturally, under the influence of insulin, blood glucose levels decrease. Normally, if we, for example, eat a large meal, under the action of insulin, glucose moves into the liver and is stored as glycogen. If we go without food for a while, glycogen breaks down and maintains a normal blood glucose level in the body from 3 to 8 millimoles per liter. If there is not enough insulin, glucose cannot enter insulin-dependent organs and its concentration increases. Accordingly, the viscosity and density of the blood increase. The blood itself begins to act as an osmotic diuretic, leading to frequent and excessive urination with significant water loss, which causes thirst. If there is not enough insulin, fat tissue breaks down instead of being synthesized, resulting in weight loss and consequently increased appetite and an energy deficit. Fat breaks down into ketones. They are toxic agents for the body, which can cause nausea, vomiting, intoxication of the nervous system, brain swelling, acidification of the body, leading to ketoacidosis. Considering that in such a situation fats cannot break down into carbon dioxide and water, this condition is called ketoacidosis. Insulin has been used since the 1900s, when it was first synthesized and administered to an infant suffering from ketoacidosis with the mother's permission. Before insulin was synthesized, patients' life expectancy was about 1 month. There are several types of synthesized insulins. These include short-acting insulins, intermediate-acting insulins, and long-acting insulin. We mimic the physiological secretion of insulin in a healthy person. Ultra-short-acting insulins have been developed, ultra-short-acting insulins. This is already a genetically engineered product. In it, 1 or 2 amino acids have been replaced. All insulins are administered parenterally. Since it is a protein, naturally it would be destroyed in the gastrointestinal tract. What are the possible methods of insulin administration? Possible options include an insulin pen and an insulin pump, a syringe and insulin pen is a dispenser with a small needle. The patient sets the specific dose and injects it subcutaneously. But as for the insulin pump, I'll go into a bit more detail about it. It's a device that is worn on the belt. A small tube extends from it with a catheter and a needle at the end. What for? To provide a constant supply of insulin, essentially simulating the function of the pancreas. Basal secretion occurs once every 3 to 5 seconds, and after meals, a bolus dose is calculated using a special calculator. It's a very convenient device for continuous use. Naturally, only ultra-short-acting insulin is used. What self-monitoring tools are used? Glucometers are used. We all know what they look like. They are portable self-monitoring devices. There is also a continuous monitoring device, similar to an insulin pump, but it has exactly the same kind of catheter at the end. Every 3 minutes, it measures the blood glucose level and converts these readings into venous blood value. In other words, the patient receives a constant reading and has a continuous blood glucose value.